Knock knock.
Man.
Hi. The first thing that I'm going to do is gather my supplies, which is everything laid on the table as far as my pen light, stethoscope, blood pressure cuff, pulse ox, tongue depressor, any documentation needs, as well as gloves. The next thing that I'm going to do is perform hand hygiene, introduce myself to the client. I am Ashley. I am a student nurse at Kilgore College. Then I'm going to identify the client using their name and date of birth and correlate it to their wristband. At this point, I'm also going to assess their level of consciousness. So, can I please have your name and date of birth?
Cadence Harris, 0801 2006.
All right, then I would check it to the wristband. And in addition, I'm going to ask Cadence, where are you at?
The doctor's office.
Can you tell me why you're here today?
Just a checkup.
Okay. Can you tell me what time of day it is, like morning or afternoon?
It's the afternoon.
Okay. And can you tell me the president?
Joe Biden.
Okay. Cadence, do you have any allergies? No allergies that are known. Okay, so what I'm going to do today is be performing a head to neck assessment, including your vitals. Is that okay with you?
Mm-hmm.
Okay, and now I'm going to position the client in the correct position to do this procedure. And when we're doing this, the first thing that I'm going to do is assess your general appearance. Obviously, I wouldn't be saying this to the client, but it's something I'm noticing on my own. Her facial features seem normal. Her body position is correctly aligned in the chair. Her skin color seems normal and pink. I'm also going to assess her nutrition, which, Cadence, can I ask you, what do you normally eat on a day-to-day basis? Or can I ask you, what did you eat today?
Some soup.
And what else did you eat today, Cadence?
And some bread.
You had soup and bread all day today. That was your only meal? Is that what you normally eat on a day-to-day basis?
Sometimes I'll have pizza.
Okay. But that's your normal nutrition habits, is pizza and soup. Okay. The patient's speech seems normal. Her hearing, she's able to hear me normally. Her mood seems normal in appearance and average. Her hygiene seems normal as far as, well, average is where she is wearing clothes that are appropriate to the time and day and the season of what is going on right now. All right, the next thing that I am going to do is ask you, Cadence, are you experiencing any pain on a scale from 0 to 10? 0 being no pain, 10 being a whole lot of pain, and if you're experiencing this pain, please tell me where it's occurring.
0.
So you're not experiencing any pain?
No.
Okay, so everything's good. Okay. The next thing I'm just going to do is your vitals, and I'm going to start with
My left arm.
your pulse. And is it okay if I hold your arm right here? Okay. All right. Give me a second. If you can keep your arm relaxed, please. All right, at this point, I'm going to document that her pulse was at a 70 and her respiratory rate was at a 16. The next thing I'm going to do is use pulse ox, and I'm going to take her pulse ox by placing it on her finger. If you can just sit here for a second. And her pulse ox shows to be 98%. The next thing that I'm going to do is take her blood pressure. And Cadence, do you have a preferred arm that you would like me to use?
The left one.
All right. Gonna make sure to place this at her arm. If you can please relax your arm. All right, Cadence, your blood pressure is 122/78. The next thing that I'm going to do is take your temperature. So if you can please open your mouth. I'm going to place the temperature underneath your tongue. Please lift your tongue up. Okay, close your tongue back down. All right, your temperature is 98.6, which is perfect. Okay. Cadence, can I please have your height?
5'5".
I'm sorry?
5'5".
And what is your weight?
240.
All right, Cadence, the next thing that I'm going to do is begin my assessments on your head and face. I'm going to put gloves on to be able to do this. Can I ask you, are you experiencing any migraines or pain in your head?
No.
Okay, have you had any recent falls?
No.
All right. What I'm going to do is first assess the color and symmetry of their face. Your eyes seem symmetrical, your ears, you don't have any type of unnoticed, that would be not normal symmetry on your face, okay? Now what I'm going to do is I'm going to palpate, and basically what that means is touch your scalp. Are you okay with that? At this point, I'm looking for any lesions, I'm looking for any open sores, as well as any lice, hair loss, anything that would be a normal finding when I'm looking at their skin. You also want to look at the back of their head if they're a patient who is bedbound, to make sure there's no sores back here, which there isn't. So your scalp looks great. I'm also going to palpate the frontal sinuses and the maxillary sinuses. When I'm doing so, please let me know when I'm touching if there's any pressure, like pressure or pain when I'm doing so, okay? Does this feel okay?
Yeah.
Do you have any pain?
No.
Okay, do you have any pain?
No.
No? Okay. All right. I'm gonna take my gloves off. Next thing I'm gonna do is I'm gonna look at your eyes, Cadence. And can you tell me, do you wear any contacts or glasses?
No.
Do you have any discharge or pain coming out of your eyes? Any abnormal vision?
No.
No. So none of that. All right. I guess I can put another pair of gloves, and I'm putting on a pair of gloves, and I'm going to look at your eyes for any redness, yellowing, jaundice. In addition, I'm going to pull down your eyes to see if there's any redness in that area as well. There isn't. So I'm going to perform a few different eye tests on you. Okay. Your first one is going to be your peripheral vision. I'm going to stand behind you with this pen light. Please tell me when you can see the pen light.
I see it.
Okay. Let's try on this side.
I see it.
All right. The next thing I'm going to do is test your muscular eye vision. And what I'm going to do is take this pen light, I'm going to move it in various directions. Please keep your head stable and only move your eyes. Okay? All right, great. The next thing I'm going to do is assess your perula. And what I do for the first thing is going to be to dim the lights. I don't have a dimmer on my lights, so I can't dim them. What I'm going to do is ask you to look straight forward. Let's say, look at the microwave, okay? And then I'm going to take my pen light and put it over your eyes and just keep looking straight forward. What I'm assessing is if your pupils are reactive and staying in. Are you ready? All right, you ready for the next one? Keep looking straight forward. All right, great job. The next thing I'm going to assess is your accommodation, which I'm going to have you look at this pen and keep looking at it. I'm going to move it closer to your face. Okay, just keep looking at the pen. Good job. The next thing I'm going to have you do is look at my pen and then the wall or the microwave. Ready? Look at my pen. Look at the microwave. No, I need you to look at straight forward. Look at my pen. Look at the microwave. Look at my pen. Look at the microwave. Okay. At this point, we have assessed the perula. Her pupils are equal, round, reactive to light, and they accommodate. All right. The next thing that we are going to do is your ears. Cadence, have you been experiencing any ear pain, drainage, anything going on with your ears lately?
No.
Nothing whatsoever?
No.
Okay. I'm going to, again with gloves, I am going to look at your ears. The first thing I'm going to do is assess the outside of your ears and populate the outside for any bumps, lesions on both sides of the ears. At this point, I'll also be looking for symmetry of her ears on her face. They all look great. Now, I also need to look at the inside of your ears. As you previously stated, there's no drainage, no ear pain, nothing. Look at the inside. I don't see anything going on in the inside of her ears. Okay. Now, Cadence, what I'm going to do is a test called the whisper test. I'm going to stand behind you. I'm going to say 3 phrases. I need you to repeat them back to me. I also need you to cover the ear in which I'm not speaking into. So we're going to start on this side. So if you can please cover this ear. I'm going to stand behind you and say 3 phrases.
Blue,
Orange.
orange, yellow,
All right. Can you please cover your other ear?
girls, boys, 2.
All right. Okay, so now that we're done with your ears, we are going to go to your nose. Okay? have you had any recent issues with your nose? Any drainage, extra sinus issues, or any problems with your nose? Congestion?
No.
So you haven't had any issues. Okay, so again, we need to make sure I have gloves on. We're going to inspect, make sure the nose is in the midline of the face, at the symmetry of it. Can I ask you please to, we're going to check each nostril. So if you can please place your finger over the right side of your nostril. Breathe in through the left. Okay, let's do it through the other side. No issues? All right, now can you please lean your head back? I'm going to look inside your nostrils, again with gloves, to see if there's any drainage, polyps, anything going inside your nose. All right, Cadence, I don't see anything. Hang on 1 second. I don't see anything going on with your nose. The next area we're going to move is to your mouth. Okay? Can you please tell me if you've had any issues swallowing, any teeth issues, gum, sores, nothing has been going on with your mouth?
Mm.
Okay, the first thing I'm going to do is ask you to swallow. Take a big gulp in and then try to swallow. Are you having any issues swallowing? Everything's okay? All right, I am going to use my tongue depressor. And I'm going to ask you to stick out your mouth. And at this point, I'm going to use my pen light, and I'm going to look inside your mouth for any lesions, sores. Make sure your gums are red, your tongue is normal. It isn't like a beefy tongue. In addition, I also need to make sure your lips, everything has moisture and not cracked. Okay, can you please open your mouth? All right, I'm going to use this. Look on the side of your gums. Everything seems okay. Lift your tongue up for me, please. All right, there isn't any noticeable lesions or sores inside of your mouth. Okay, the next thing that I'm going to do is, oh, well, I forgot. Let me make sure to lift your head up, and I want to look and make sure your trachea is aligned, which I guess that would be inside of your neck. That's the next process we're going to do. And your trachea seems to be aligned within your neck. Can you please lift your neck up a little bit more for me? There you go. Thank you. I'm also going to ask you, are you having any neck pain? Nothing's going on with your neck at all? All right. I am going to assess your lip nodes for any. When I'm doing this, please let me know if you have any tenderness or pain. There's no tenderness or pain?
None.
Okay, I'm going to palpate your carotid arteries, which are on each side of your left and right side of your neck. I'll be doing one each time, okay? Maybe you could just leave your face forward. Good and bounded. Good and bounded. All right, I'm gonna have you turn your neck to a 45-degree angle to assess your jugular vein over here. All right, can we please do the other side? It does not seem to be ascended, which is good. The next thing I'm going to do is check for your range of motion. So I'm going to ask you to turn your head to the right, turn your head to the left, turn your head up, turn your head down. Did you have any pain when you're experiencing that? Okay. Next thing I'm going to do, Cadence, is I'm going to place my hands on your shoulders. I'm going to apply some resistance, and I want you to lift your shoulders up like this. Okay? Ready? Are you experiencing any pain when doing so?
No.
Okay. Do it one more time. All right. Have you been satisfied with your assessment? Do you have anything you need to talk to me about, or are there any concerns?
No, everything's fine.
At this point, I want to make sure you're in a comfortable and safe position, perform my hand hygiene, document any findings, as well as notified any other relative health providers that I'm working with if there were any abnormal findings.